The Enlightenment trend of methodically analyzing all elements of society shaped how religion was practiced and perceived across Europe. Despite changes in religion, most Europeans remained devout Christians. This can partially be attributed to the fact that Enlightenment philosophers did not direct their messages at the common people, who they felt were too uneducated to take part in intellectual debate. Keeping with medieval tradition, the local parish church continued to be the center of community religious and social events. The church played an integral role in community life by educating the common people and keeping records of births, deaths, and marriages. Local religious life came under heavier state control when new monarchs began creating and taking control of official national churches. Protestant churches of the 1700s had abolished the practices of saint worship and pageantry that they felt detracted from the purpose of religion. However, many Protestants felt that the church was stagnating and slipping into dead doctrinal conformity. Meanwhile, churches in Catholic Europe were flourishing due in part to the emotions and themes elicited by Baroque art.
The states of both Catholic and Protestant nations began to take control of the churches in their respective nations. This is seen by both France and Spain pressuring the church to dissolve the Jesuit order in 1773. Both France and Spain had assumed control of the clergy, choosing the individuals in their positions. Joseph II also dissolved the monasteries, believing that the monasteries did not contribute to society. He then used the money for charitable purposes, such as paying ordinary priests more. Joseph II also set a precedent for lifting restrictions on Jews, also a weaker Catholic Church than before. However, the Catholic Church was still an integral part of the community. Because of this, more people in Catholic countries actively participated in the Catholic faith than Protestant countries. A revival of Catholicism, known as Jansenism, spread through the Catholic countries, but especially France. Jansenism said that predestination was God's way. This was condemned by the Church as Calvinist heresy. The French lower classes developed a different form of Jansenism than the higher classes. Much like Catholicism, some believed that the Lutheran faith had lost the original goal of bringing all believers closer to God. The Protestant revival of Pietism obtained followers because it gave people a warm feeling that everyone could experience. It also returned to the original idea of priesthood of all believers more radically than before. To help realize this, Bible readings were taught to children, increasing the literacy rate. John Wesley, an Anglican, started the Methodist faith in Oxford University through his Holy Club. Wesley was distressed by the English government using high positions in the Church of England as a reward.
The changes in religion during this time had far-reaching significance. The rise of Jansenism in Catholic Europe signaled a revival not seen in many years. While the Jansenists were Catholics, and devout ones at that, the Holy See and the Jesuits believed them to be contaminated by Calvin's heresy, and thus began to crack down upon them. This effort stifled what could have become a rigorous religious revival that could have gone even farther than the Counter-Reformation. Due to the Jansenist movement, there was a large increase in tensions between the common people and the monarchy in France. These tensions arose out of the obscene decadence of the royals and the nobles, and the Jansenist ideals of an austere church and life. A rise in tensions between these two groups was disastrous for both parties, as once tensions boiled over, the French Revolution and all of its blood and tyranny were the effect. The Age of Reason also caused this dissociation between the enlightened thinkers and the common people, because the educated elite viewed their superstitious views on spirituality and faith as almost not even Christian. This disconnect did not help bind these groups together in the years to come. Protestant Europe was also rocked with change as the Reformation continued to branch out. With the addition of the Methodists to the uncountable numbers of sects now present in Protestant Christianity, the Reformation's focus was further fractured. Some Protestant nations attempted to unify religiously and found it very hard. While the Reformation was still united against Catholicism, it fractured internally. With the Enlightenment taking hold across Europe, the time of witch hunts came to an end, because it was seen as a superstitious tradition that was far more harmful than helpful.
Prior to the Enlightenment and Scientific Revolution, knowledge of human anatomy and medicine were extremely limited. Medical aid consisted of faith healings, apothecaries, surgeons, and physicians. As this time remained very religious, faith healings were extremely active. Believing that evil spirits caused diseases, the only cure was an exorcism, a religious ritual that drove the devil out of the human body. This view of healing was most popular in the countryside, whereas cities preferred apothecaries. Apothecaries sold medicines, herbs, and drugs. Unlike faith healings, some of the treatments advised for illnesses actually worked, such as laxatives for constipation. Aside from apothecaries and faith healings, physicians and surgeons were also significant in the field of medicine during this time. Bloodletting was a popular method of treatment used by physicians, as it was considered to be a cure for most diseases. It was thought to remove the bad blood, thus the illness, allowing one to go healthy again. Surgeons were forced to work without anesthesia, as it was too dangerous to use or control. Consequently, many patients died from the sheer pain of operating. Additionally, understanding of bacteria, infections, and the importance of sanitation was non-existent. Thus, infections also led to many deaths during surgery and allowed diseases, such as smallpox, to thrive. These occupations were generally held by men from affluent families who could afford the years of training, and mainly treated those of a similar social background. All these practices changed during the Enlightenment and Scientific Revolution, becoming more efficient, safe, and healthy due to new discoveries and innovations.
The Enlightenment and Scientific Revolution brought more research and experimentation to the medical field. More significant medical advancements, however, would come later in the late 19th century. The intensive study of anatomy, as well as extensive practice on the bloody battlefields, helped surgeons improve their skills and raise the art of surgery to a higher standard, since it was previously equivalent to butchery. As scientists amassed more accurate information, they began to publish their findings to help spread knowledge of new research. For example, Madame de Coudray, a successful French midwife, wrote Manual on the Art of Childbirth and traveled France to teach healthy birthing techniques to village midwives. She constructed a life-size model of the female pelvis and a fetus to demonstrate her research to illiterate women who could not read her textbook. The invention of forceps and other medical instruments also helped women give easier, healthier births. The role of women in medicine throughout the Middle Ages and the 17th century was about equal to men, but when the number of universities began to rise during the Enlightenment, women were seen less and less in scientific fields. This is because, while both men and women were relatively uneducated about medicine in the Middle Ages, only men received an education at a medical college in the 18th century. Women lacking diplomas were banned from practice. Despite this, women were relatively successful in keeping their position as midwife. With the scientific advancements of the Enlightenment came more of a desire to fight human problems, such as infectious diseases. After the bubonic plague began to disappear, smallpox arose as the most deadly disease of the 18th century. The eradication of smallpox is attributed to Dr. Edward Jenner and his scientific breakthrough, which was perhaps the greatest medical triumph of the century. Jenner discovered that vaccinating smallpox patients with cowpox would rid them of the disease. He published his findings, and soon his treatment spread over Europe and the rest of the world, quickly wiping out the vicious disease.
In the 19th century, there was an increase in the study of the human anatomy. With a new, more thorough look at the human body, battlefield surgeons were capable of improving the techniques used in amputation. This greatly increased the likelihood of a soldier surviving. Unfortunately, until the 19th century, medical experts still lacked proper knowledge of anesthesia and cleanliness. Many patients died from intense agony and shock, while others became infected. Although many physicians were willing to experiment and study anatomy, the majority were stuck on old methods, such as bloodletting and purging. Dr. Edward Jenner, on the other hand, with his cure for smallpox, was the first to coin the term vaccination. While the practice of vaccines had been established long before in the Ottoman Empire, Dr. Jenner is often given credit.